Get asked all the time about diabetes. How do I know if I have it? I've got a family history of it, but how do I know if I personally have it? Well, it goes back 10 years before you hear the first words, you have diabetes. You've had it for 10 years. It's been brewing, it's been coming up, it's been inflammation. You've had hints that it's going on. We have the technology now to diagnose diabetes 10 years before it actually happens. And we can prevent it from hitting you, from actually becoming diabetes for 20 years, maybe 30 years. That's great news for everybody. But it comes right back to the 4 pillars of healthcare, right? Diet, exercise, get enough sleep, and your mental health. So how do you learn early? How do I take care of myself? You partner with a doctor who believes in the 4 pillars, and that could be a naturopath, homeopath, chiropractor, acupuncturist, but tie in with your traditional medicine doctor so that you understand, they understand how it all ties in together. Just having a traditional doctor is probably not enough. You need to learn the information yourself. So how do I do that? Everybody, I say everybody, 98% of people who make it past 50 will get diabetes, cholesterol, and high blood pressure sometime in their life. Let me say that again. People don't understand that. If you make it past 50, you got about a 98% chance of getting diabetes, hypertension, high cholesterol in your lifetime. So that doesn't mean you have to get it at 60. How do you delay it until 95? How do you delay it till even 90, right? Goes back to the 4 pillars of healthcare. Watch while you're eating, get your daily exercise, and I do mean daily, 6 days a week at least. It's not enough to do 3. Get a good enough sleep. Make sure your mental health is stable. If you're stressed, we have some really great treatments without medication, and we'll do another video on that. So come back to the channel, ask Dr. Bouvier, and come to the YouTube channel, sign up, newsletter, and you'll get more of this good information. However, getting back to the current question on how do I prevent this, it's getting good knowledge and understanding about it. So get blood work. If you're 30, you should be getting blood work twice a year. If you're 45, you should be getting blood work 3 times a year. It's all about prevention, correct? So be ready. Have a what if kit, your what if kit, and we'll do a special video on that sometime in the near future. But your what if kit includes a blood sugar checker. But you say to yourself, well, but I don't have diabetes. Well, some in your life may have diabetes, you're gonna need that kit, but you should be checking yourself once a month. If you're over 30, it's a simple check. We don't want surprises in your life, okay? So, number 1, if you're over 30, get your blood checked twice a year. If you're over 50, get it checked 3 times a year. I'm 70 years old. I get it checked every 3 months. Now, I know I'm medical, but I still get it checked every 3 months because I've been on the cusp of blood sugar issues in the past. I've been able to reverse it with the 4 pillars of health, but I want to know earlier than later if I'm going to be going into that diabetic or pre-diabetic range. Most people become pre-diabetic 5 to 10 years before they're diabetic, and we can check that for you if you're following good health care. Again, this is Ask Dr. Bouvier. Have a great day.